My name is Kevin Douglas Berg. This is What Was I Saying, blog KDB. I'm here to provoke thought, move humanity just a little bit forward. Uh, I'd like to talk to you about my nasal surgery, as well as I just realized when I got my nasal surgery, my neck was not examined. My neck was not examined to see that my vertebrae was hyperextended, which led to my migraines. I only say that because I got nasal surgery. My general practitioner stopped prescribing antibiotics as the number of sinus infections I got was like 6 to 8 a year. She's like, I think you need nasal surgery because of how many sinus infections you got. I went to ENT, they checked me out and everything. They did the scan of the head, but I really don't think they looked at the base of my neck, which was looked at a couple of years ago, and I found out I have a herniated disc, which impacts the nerve, which gives me the migraine. It goes like that from there to there. It's funny because if you need this to get it done, I had a great guy in ENT. He was off Bethel Road. It's called ENT specialist, I guess. And he actually did my ex's vocal cord surgery too, that she had done. If you need this because you get migraines and you drink plenty of water and they find you are suitable for it, I want you to consider things. Consider you can lose your taste. Not all of it, but some of it. Consider you can lose your sense of smell. Not all of it, some of it. Of course, consider that you sign a waiver that it could cause brain damage because they covered it there. But I was such an extent, I would get no more antibiotics to get over my sinus infections. And when you have a sinus infection, all you want to do is sleep, and you got pain in your head like nobody's business. You got pain here, and you got pain here. I'm discussing this because I thought possibly people would like to know. Post nasal surgery was not that hard for me. I was with someone in the past, and it was very difficult for that person. It's all in the surgeon's technique and what they do and how they do it. As well as some people say, I have to repeat nasal surgery, and that does happen. I did go back to my ENT for a checkup at one time. He's like, nothing's wrong with you. Just take Mucinex. No joke. Take Mucinex. That was it. I still, as you all know, get migraines. I will forever still get migraines. Is it related to this? Is it related to my stress? Is it related to my gut? Is it related to my psychosomatic? Probably yes, no, and all the above. But when it's so debilitating, you're not getting antibiotics, and as the antibiotics have to get higher, and higher, you can become immune to them, and then you're really screwed. Then you could be really screwed. And you don't want to do that to your system. I'm trying to think when I had my last sinus infection. I can't recall. Honestly, I can't recall. Afterwards, you have phantom smells, things like cigarettes and that comes and goes still to this day. But, and it took 4 to 5 weeks to get my taste buds back. My ex father-in-law got it done, and it took a lot of his sense of taste, a lot of his sense of smell away. That was way back when, so it's all relative. I would say try to do everything you can not to do it. Do the neti pot. I don't do the neti pot. But do neti pot, flush. Drink plenty of water. I gotta drink at least one of these a day. No joke. After what they did, if I don't drink one of those a day, it's all on me. As well as a light headache is the first sign of dehydration. And you can tell if you're drinking enough by looking at the color of your urine. You want it clear. So you want it clear. Anything else means you're dehydrated, kind of thing. Not a doctor, not trained, just experienced nasal surgery at 41 years old. That's about it. My name is Kevin Dosberg. This is What Was I Saying Blog KDB. I'm here to provoke thought and move humanity just a little bit forward. And with that, we pray. Pray for you, pray for me, pray for everybody serving, has served, fighting with PTSD, pray for everybody in the hospital, outside of the hospital, pray for all first responders, pray for everybody in the medical field, pray for those in uniform, and pray for you and me, more please. Coming out.